Hello and welcome back to the Truth About Hemorrhoids question and answer. Today we have a question from Mark. He says, Brian, I have heard that everyone has hemorrhoids. Is that true? If so, then is it normal for them to hurt as you get older? I'm confused. Well, it's true, Mark, that everybody does have hemorrhoids. They're a vital component of the human body that help control the opening and closing of the interior body cavities and are found in the anus and in utero areas. Hemorrhoids are vascular cushions, or for a more visual explanation, when your sphincter closes, it really isn't closed tight all the time. To illustrate this, you can sit in a chair and notice that if you consciously close and retract your sphincter muscle, you will find that it is rarely closed tight unless you consciously apply pressure. So if it's not closed tight on its own, what closes off the anal cavity? Well, that would be the hemorrhoids, or vascular cushions as they're referred to. So picture them as kind of like a pillow that you would plug the hole that is left when your sphincter is still open a little bit. And that's the function of your normally healthy hemorrhoids. They work in connection with the outer and inner sphincter muscles to seal off the anal cavity. So you can probably start to see from the description of what hemorrhoids really are that they shouldn't really hurt. However, what we commonly refer to as hemorrhoids is when the vascular cushions, or the healthy hemorrhoids, produce symptoms and then cause pain. This can happen when they become enlarged, inflamed, thrombosed, or prolapsed. What, though, would cause them to become enlarged, inflamed, thrombosed, or prolapsed? Well, most doctors agree that low-fiber diets cause small caliber stools, which result in straining when you're using the bathroom. This increased pressure from straining causes engorgement of the healthy hemorrhoids, and that leads to the above symptoms. As well as aging, that's a major factor, as it promotes a weakening of the support structure of the vascular cushions. Prolonged sitting on the toilet. Many of us read for long periods of time on the toilet, and those activities are believed to cause a problem with the support structure that holds the healthy hemorrhoids in place and result in enlarged and thrombosed hemorrhoids. Pregnancy also clearly predisposes women to symptoms from hemorrhoids, although the exact cause is still unknown to doctors. However, most women revert to their previously asymptomatic state after delivery. The reason why is still unknown. Doctors do believe, however, that the relationship between pregnancy and hemorrhoids lends itself to the hormonal changes and direct pressure as the culprit. So in answer to your question, yes, everyone has hemorrhoids. Even as young as when we're embryos, we have developed hemorrhoids. But it's not normal for them to hurt. Well, you may ask the question then, why do so many people have hemorrhoids that hurt? Mainly, it's because of our diet. I read an article just the other day. It was written by Dr. Scott C. Thornton, MD, Associate Clinical Professor of Surgery at Yale University School of Medicine. He's the Director of Colorectal Teaching, and he stated, quote, "The average American diet consists of 8 to 15 grams of fiber per day. A high-fiber diet includes more than 25 grams of fiber per day." He also stated in his report that phylum seed, or Metamucil, significantly decreases bleeding and pain associated to enlarged hemorrhoids compared to placebo tests that he administered in his study. So it's interesting that the average American diet consists of 18 to 15 grams of fiber per day, but Dr. Thornton said that a high fiber diet, which is what humans need to maintain healthy hemorrhoid function is 25 grams of fiber per day. So especially for those of us who are younger, maybe we eat fast food more than we should, we're probably on the lower side of that average American diet, closer to the 8 to 10 grams of fiber per day. And over the course of weeks and months, you can see how that adds up to a huge deficiency in our fiber intake. And that leads to the engorgement of the hemorrhoids that we were talking about earlier. And when we engorge the hemorrhoids and irritate them, that's when we begin to have problems. And what typically happens is we'll start seeing maybe blood in our stool if we have internal hemorrhoids, and then we just say, well, wait a minute, we've got to do something about this. So for a short while, we'll increase our fiber intake, whether it be through supplements like Metamucil, or we'll start to just eat a higher fiber diet, and that will go away. But the damage to the hemorrhoid doesn't necessarily repair itself, because it's not a part of the body that's created to repair itself. And eventually, if we've damaged the hemorrhoids, we're going to need a surgeon's assistance to repair the damage. Mark, we appreciate the question, and we'll see you next time on The Truth About Hemorrhoids. Remember, you can submit a question through our YouTube page. You can go to our website, www.truthabouthemorrhoids.net, and you can go to the questions and comments section. You can look at other questions that have been responded to, and you can also submit questions there. We thank you, and until next time, go get yourself fixed.